Good afternoon, ladies and gentlemen. My name is Jessica Medina, and I will be going over the cons of medical marijuana. The side effects of medical marijuana are they are addictive, it's a harder drug use, it interferes with fertility, impairs driving ability, and injures the lungs and the immune system, and the brain. These are all cons of medical marijuana. In this part of the presentation, I will cover the argument of why we shouldn't use medical marijuana. Some of us would love to use marijuana to help with our loved ones that have cancer, PTSD, HIV, AIDS, or arthritis. But for some, they say it is bad for us to use, and I'll explain to you why. The cons of using medical marijuana, some say that it's too dangerous to use, lacks FDA's approval, and that various legal drugs make marijuana an unnecessary use, says procons.org. According to livestrong.com, medical marijuana at the argument against the use indicates the risk of interfere effectiveness in treating glaucoma and increases risk in developing certain types of cancer. Marijuana is a very strong drug and has some serious side effects. Based on the scientific evidence published to date, it is in the opinion of the Department of Health and Human Services that marijuana has a broad range of psychological and biological effects, many of which are dangerous and harmful to health. Marijuana is not a vegan drug. As Surgeon General, I urge other physicians and professionals to advise parents and patients about the harmful effects of using marijuana and to urge the discontinuation of the use. In an effort to determine whether marijuana or drug differed from marijuana might be effective as a glaucoma treatment, the National Eye Institute supports researchers. Studies began in 1978. However, none of these studies demonstrate that marijuana or any of its components could lower IOPs as effectively as drugs already on the market. In addition, some potentially serious side effects were noted, including increased heart rate and decreased blood pressure, in studies using smoked marijuana. The identification of side effects from smoking marijuana complied with the emergence of high effective FDA approval medications for glaucoma treatment may have led to diminished interest in this research area. National Eye Institution, glaucoma and marijuana use. 3 to 4 cannabis cigarettes a day are associated with the same evidence of acute and chronic bronchitis and the same degree of damage to the bronchial mucus of 20 or more tobacco cigarettes a day. Cannabis smoking is likely to weaken the immune system, affect the lungs, are due to combination of smoking related damage to the cells lining the bronchial passage and impairment of the principal immune cells in the small area. Can medical marijuana help patients with cancer, HIV, AIDS, glaucoma? Can it hurt patients more than actually helping them? It can help and it can't help patients all at the same time. Patients can be hurt by the marijuana inside of them, of helping them. The marijuana cannot take an effect like it should, and it cause decreased blood pressure, increased heart rate, and even lose your life. The problem of wanting to use marijuana for medical use is simple. Using it can seriously affect your short-term memory, can damage your lungs. Also, there is not enough evidence that supports marijuana as an effective pain-relieving drug. It also carries a risk of abuse and addiction. With this being said, this should be stopped on wanting to use as a medical purposes. The next speaker will be Miriam Aureliano. She's going to choose a stand on marijuana. It is important to her because politically a national decision needs to be made in order to give relief to thousands of people with medical conditions.